Okay, so thank you all so much for coming. My name is Catherine Getchell. I'm the director of the Office of Disability Resources. And with me is our intern, Amy Tavares, who's finishing up her internship with us. She'll be finishing in June. I just want to give a shout out. Congrats to Amy for graduating. Amy now has her master's in clinical mental health and rehab counseling from the University of Pittsburgh. Hot off the presses, so go Amy. We've had absolutely fabulous responses for this webinar, and you guys have submitted some amazing questions and scenarios that we have really done the best we can to weave into our presentation. So thank you so much for doing that. We're gonna, because we have quite a number of folks here, we're gonna ask people to use the chat function for questions, and just so we can kind of keep things moving. And we've made sure to save time for questions at the end. So, we'll pick those up. We're also going to do some breakout rooms and that kind of stuff. And we will send out the PowerPoint at the end of the presentation. So I will kick it off, send it over to Amy. Amy, take it away.
Thanks, Catherine. Hi, everyone. Thank you so much for coming today. Like Catherine mentioned, we have taken the great responses that you've sent to this meeting and tried to do this discussion based off of what you all kind of were asking and scenarios you presented us with. And so the agenda for today's meeting is first, we're just going to go over some general tips on how to support students with emotional and cognitive differences. Then we're going to talk about how to identify specific needs for students, and then how you can refer those students to resources on campus. Then we're going to briefly talk about how to support students that are resistant or may not be responsive. And then we will briefly talk about some tips on supporting students virtually. And then after that presentation, then we're going to do some breakout sessions with some case scenarios so that we can all kind of discuss how you would go about supporting this student. And so before we kind of begin, I'd like to define what emotional and cognitive differences mean. Most of the time people kind of define emotional and cognitive differences with diagnoses like autism, depression, ADHD, and things of that nature. But I'd like to kind of shift our focus onto not necessarily a diagnosis, but focusing on an individual's strengths and needs. Oftentimes in our work, we're not going to know about the student's diagnosis, and also oftentimes students with the same diagnosis may have different needs. So we're going to focus on their strengths and needs on an individual level. And so just some general tips on supporting students with differences. So first, you want to self-reflect and recognize your biases and perceptions. So we all have some biases and perceptions, and so we want to be mindful of how those can affect the way we work with students. And so especially with the way a student may present their behaviors, you don't want to make assumptions based off your biases. You want to meet the student where they are and define what their individual strengths and needs are. And then also it's important to assess your comfort level. So one of the ways to do that is to participate in professional development opportunities to learn more about how to support students. And then also knowing when it's time for you to kind of consult with colleagues or other CMU resources is also really important for you to know when working with students. And so the second tip would be to create a comforting environment for students. So one of the ways to do that is to make your availability and openness known. So there is this power differential between faculty and staff and students. And so to kind of break down that power differential and to make students more comfortable, letting them know that you're open and available to meet with them if they're struggling can be really powerful for students. It's also important to protect students' identities as well. So especially if you're going to talk to students about some concerning behaviors, you want to do it in a more private setting and avoid writing things over email. And then it's also important to give students time to process and respond. So often there's like this social norm of that in a conversation, people are kind of, one person's finished, another person should start talking, and that's like a key indicator of people listening and engaged. But some students may take a bit more time to process what you're saying and may need more time to come up with responses to what you're saying. So give them some time to do that. This isn't always possible, but if possible, adjust your physical space to make it more welcoming. So many students may feel very overstimulated by a lot of light or noise. So trying to decrease that, if possible, can be really helpful. And then lastly, provide different methods of communication for students. So if you notice that you're meeting with a student and they're having a really hard time verbalizing what they're trying to say, it might be helpful to have a pad or a pen on the table for them so that they can use that if they feel that they need to express their thoughts through written communication rather than verbally. And then lastly, be mindful of your communication. So it's really important to ask questions because that can help you better understand a student and help them connect with resources that would be most beneficial to them. And especially because you only really see students in one facet of their life, and so asking questions can give you a bigger picture. And then when you're communicating with students, it's important to be direct, honest, and sensitive. Being direct is important to kind of help with that, to alleviate some miscommunication. And being honest is really important as well, because outside of the university, there are going to be a lot more, people may not be as forgiving. So being honest is really important to help students gain insight. And then being sensitive, because a lot of times when you're bringing up concerning behaviors, students may not feel comfortable or they may never heard that before. So ways to be sensitive when you're talking to students is highlighting their strengths and validating their feelings when they share them with you. And then also, whenever you're providing guidelines and instructions, it's important to be very short and concise to help with miscommunication and make things more clear for students. So now we just talked about general needs for students, and now we're going to talk about how you can identify needs for students. So based off of a lot of your questions and the scenarios that you shared with us, it's very clear that you all kind of know when you need to kind of step in and talk to students about some concerns that you may have. And so right now what we're going to do is we're going to focus on areas of difficulties, and when you notice a student is exhibiting behavior that relates to this area, how you can support them in that way. So the first area of difficulty we're going to talk about is executive functioning. So for this scenario, we're going to talk sorry about that. We're going to have Dylan here as a case example. So you've been working with Dylan on creating schedules and to-do lists to help them stay on track. However, Dylan doesn't seem to use them, and they continue to stay up late, which causes them to be late or miss meetings. So some other examples of students exhibiting behavior that might indicate that they're having difficulties with executive functioning is missing assignments or submitting assignments late, having difficulty organizing and executing projects, and then also procrastination. So support strategies for Dylan, along with other students that may indicate they have difficulties in this area, would be to collaborate on goals and schedules with the student and let the student take the lead. So in particular for these kind of difficulties, it's really important that the student take the lead on coming up with strategies to help them in these areas, because it requires them to feel motivated to actually do these do these strategies and implement them, and then they need to have the confidence to feel like they are able to use these strategies. So you want to make sure that you collaborate and you take the lead, which it seems like you have already done in this scenario with Dylan. But after you've collaborated and you let the students lead and you come up with scenarios, strategies for them, it doesn't seem like Dylan is responding. So a way that you can kind of open up this conversation with Dylan is discuss the discrepancies between his behavior and his goals. So I'm assuming that you've been working with Dylan on these schedules and to-do lists because he has already communicated with you that he wants to work on these areas. However, he's still late to meetings. And so what you want to do is, bring it up, bring it to his awareness and say, hey, so, we've talked about you working on these areas. However, you're still being late and miss meetings. And that can help students bring awareness to what's been going on, because sometimes students aren't aware of the discrepancies between what they want and how they're behaving. And then also it's important to be patient, especially with some like schedules and to-do lists. They might take some more time to implement and some trial and error, so just be patient. Another area of difficulty for students with emotional and cognitive differences could be regulating their emotions. So for this student, Hal, while meeting with him in your office, Hal begins to rock back and forth in his chair. He is breathing heavily and isn't responding to you when you ask him questions. So some other behaviors that might indicate a student has difficulty regulating their emotion is if they begin crying in class or in a meeting, if you notice there are drastic mood shifts or mood shifts over time, or having a panic attack like it sounds like Hal is experiencing, or yelling because they're really angry. And so some support strategies for Hal and other students with regulating emotions is to give them space. So you want to make sure that you're giving them physical space, especially for individuals experiencing a panic attack. They're already feeling like very closed in, so providing that physical space. Another support strategy would be to talk through breathing with them. So Hal is breathing pretty heavily, and to help kind of slow down his breathing and his heart rate, talking through breathing in and breathing out. And you want to do it with them so they are understanding what to do. And then another suggestion is to provide a pad and a pen for them within reach. So Hal isn't responding to you when he's asking you questions, but maybe he might be able to respond to you by writing things down. And then I would recommend in this situation to call CAPS, put the phone on, let the student know that you're going to be calling CAPS to provide more support for them. And so put it on speaker so you all can collaborate on supporting the student together. Another area of difficulty for students could be communication. So you've been working with Lucy one-on-one and you notice she isn't very verbally responsive. It has been difficult for you to tell if she's understanding you or confused by what you're saying. So some other behaviors that might indicate a student has difficulty with communication could be that they don't talk a lot in class or in meetings. Sometimes they might be difficult to follow. So some students might shift their focus of what they're talking about very quickly, and so it's hard to gather what they're talking about and what they're trying to say. And then another example could be that their performance doesn't match their participation. So you could have a student that is really verbally responsive in class and they share a lot of great insight, but then when you read their papers, it doesn't match how their insight in class. And so support strategies specifically for Lucy, one would be ask open-ended questions. So open-ended questions require a bit more response than the yes, no, or the grunt or the shake head. So you want to ask open-ended questions that require more response. And then another strategy could be to ask her to repeat back the concepts using her own words. This can give you more insight as to whether she's understanding what you're saying, and it can also give you insight on how she's absorbing the information. And then if you realize Lucy or students still aren't responding verbally, you might want to offer different communication methods. So you could suggest having them write their answers down or type them out. And this would be more of a collaborative process for students and you, so that you can determine what meet their needs best. And then another area of difficulty for students could be self-care. So for your student Jamal, you've noticed a few concerning changes. He hasn't been talking with his classmates before class like he normally does, and he's been falling asleep in class. So some other behaviors that might indicate that a student is having difficulty with self-care could be that they're having a significant weight loss or gain. You notice, like Jamal, they're sleeping in class. They have a strong odor or dirty clothes, or you know for a fact that they're not utilizing the resources that you've provided them before. And so some supportive strategies for Jamal and other students that are having difficulty with self-care is to remain objective when you're describing behaviors. I also think in particular for the strong odor and dirty clothes, I think people kind of tiptoe around that one a little bit because it's kind of uncomfortable to talk about. So you want to remain objective when you're describing those. And being honest, like we mentioned before. And then you want to ask questions as well. So in Jamal's case, is he having, does he have an argument with these classmates, or is he isolating himself from all of his social connections? So these are really great questions to ask to gather more information so that you can connect him to resources. Another area of difficulty for students could be social skills. So for Zara, while working on a group project in class, you notice she is speaking sharply with her fellow group members. Zara appears frustrated with how her group members are working on the project because it didn't fit her idea of how to do things. Some behaviors that might indicate a student might have difficulty with social skills could be that they're socially isolated. So you may recognize that they don't have really any friends. They have difficulty working with others. They don't talk with other classmates, or they have a hard time trying to find a group for group projects. And so supportive strategies for Zara and other students that may have difficulties with social skills would be describing that behavior and being objective when you're doing that. So to try not to offend, and then follow up with questions to show that you are interested to learning more about it, and then you can better gauge what resources would be appropriate to refer the student to. And then, of course, you're going to connect them with resources. And then the last area that we're going to talk about of that area of difficulty for students is awareness. So for Ashita, she is convinced that her grades were plummeting and she is failing your course. So when you meet with her, you discover that she has an A in the class and no pattern of doing worse. Despite sharing this information, Ashita is still distressed and she still feels like she's performing poorly in class. So some other examples that might indicate that a student has difficulty with being aware of themselves is they may respond with, "No, I'm fine," after you're bringing up some of your concerns. They make excuses for their disruptive behavior, or they continue to participate in the disruptive behavior despite consequences. And so supportive strategies for Ashita, it seems like you in this case did pretty well with supporting her. Asking question is really great to determine if this is a chronic issue or maybe this is just her feelings in this class. And then you also did a great job by highlighting the discrepancies between how she's feeling and what is actually true. So she has an A in the class and there's no pattern of doing worse, but Ashita is still distressed. So that can help students gain more insight when you bring up discrepancies. And then also, again, refer students to resources, especially in Ashita's case where she is still feeling distressed after you brought up the discrepancies. And then it's also a reminder that sometimes you've done everything you can. And so if you've referred her to resources, you know, you've asked her questions, you've validated her feelings, and you've, you know, highlighted the discrepancies. Sometimes that's kind of all you can do, but just keep doing it. And we'll talk more about that later in the presentation.
Amy, there's a question in the chat that came up that I want to just catch now because it pertains to Ashita. The question from Candace that was seconded was, can we go over what's disruptive about Ashita's behavior? And I think the answer is it's not necessarily that Ashita's behavior in and of itself is disruptive, but sometimes there are students with communication kinds of things that are going to be disruptive and are disrupting the flow of the class, or are making it difficult. If a student, for example, is really focusing, and what we would use the word perseverating, on how much they're failing when they're with you in office hours, and that's all they're talking about, you're not able to cover with them the important content that you want to go over. So you might want to kind of call that out and say, you know, I know this is something that you're really worried about and focused on, and I want to help us move towards addressing your concerns about the content, you know. And I think there was a bullet in Amy's slide that says sometimes you've done all you can do. Amy, do you want to say anything more about the disruptive part of this sometimes?
Yeah, and I guess disruptive or concerning. So I think the fact that despite the evidence against her distress, she still has those thoughts and that distress. And so by asking more questions, you might gauge whether or not this is a more an issue that is more disruptive in other areas. And so by asking her those questions, learning if it's disruptive in other areas may indicate that she might be a good person to refer to services. Okay. Any other questions, Catherine, before I move on?
No, that was just that one. There are a few that came in that we'll catch at the end, but that one was pretty timely. I wanted to jump on it.
Cool.
Thanks.
Thank you. Okay, so now we're going to talk about referring student to resources. So a lot of you talked about in your questions and in your scenarios about the language and how to bring up resources. So we're going to kind of talk about this 5-step process on how to refer students to resources. So first, when you want to acknowledge the student's behavior and express your concern. So you want to remain objective, like I said. You want to continue asking questions because you're going to learn more about how that behavior might be affecting them in other areas. And then you also, it's really important to express empathy and thank them for sharing. Sometimes when you have these conversations, students might be sharing things that they may have never said out loud. And so by expressing your empathy and thanking them for sharing, it can really ease a student's mind, and it can also kind of be relieving for them knowing that they shared something that they have never talked about before, and it was perceived like in a positive way. So then the second step would be to provide information about CMU resources. So it's really important that when you explain these services, you are connecting it with what the student is currently going through. So when you're describing disability resources, instead of saying that it provides accommodations for students with disabilities, you want to explain it as it provides provides support for students with difficulties in, and then you can talk about some of the behaviors that you've mentioned. And then same with CAPS, instead of saying support students with mental health difficulties, you want to say, in Ashita's case, support students when they're distressed and can help students develop stress management strategies. So you really want to make that connection so it feels more personal. And then you want to also validate their feelings and normalize their experience. There can be a lot of stigma around reaching out to resources, and so validating those feelings and normalizing that a lot of students connect to these resources can help put students' mind at ease and make them feel more comfortable reaching out to the services. And then the third is connect students to the CMU resource. So if safety is not a concern, you can ask them permission to introduce them to the service. That way you kind of already know that they've had that introduction. You can provide them with the contact information and leave it up to the student to reach out, or you can offer to make an appointment at that moment with the student. So again, you have more knowledge about if they're actually reaching out and connecting. If safety is a concern, you want to make sure that you're giving restricted options. So it's not really an option for you to not reach out to services, but you want to try and give them some sort of option in that process. So an example of this is, I'm going to reach out to CAPS so we can get you support right now. If I'll put the phone on speaker, would you like to talk, or would you prefer that I talk and you can fill in anything that I miss? So you're keeping the student part of this process, but you're also making sure that you are reaching out to resources if safety is a concern. And then this step may provide a little bit extra motivation for students to try and get them to connect with these resources, and reiterating that these resources are available to support them. And then the follow-up is the next step. So you can reach out to the CMU resources that you've connected the student with, especially if you think that you are really concerned about the student and you think that they would really benefit from these resources. It is good to kind of reach out to people at CMU to let them know what's happening. And they also might be able to give you more advice on how to support the student more. And then the other follow-up that's really important that I think a lot of people kind of forget is following up with the actual student. So you want to put it on your calendar that you are going to follow up with this student in a week or two. Oftentimes when I have concern about a student, I will tell them before I end the meeting that I'm meeting them with, I'm going to follow up with you in a week if I don't hear from you. And oftentimes it seems like they appreciate that check-in. And so when you do the reach out, you want to avoid asking them if they've connected to the resources. Part of that is because you don't want to sound like their parent, and it's the student's responsibility to ultimately make that connection. But you want to ask them, how are you doing? And you want to remind them that you're available for support if they need it. And then you want to repeat these steps. So why would you continue to do pretty much the same thing? So one of the reasons why is because it shows the student that you care, that you are willing to take the time out to meet with them and talk to them and express your concerns. Another thing is that it may increase students' awareness. So maybe the first time you talk to them, they're like, yeah, I'm fine, it's whatever. But then a few weeks later, you notice the same things are happening and you're even more concerned. So then you meet with the student again. The student may realize, wow, this is the second time I'm having this conversation. Maybe I should reach out to this resource. And then change isn't often immediate, unfortunately, like we would like it to. So it's good to continue to repeat the process. So students that might be resistant or don't respond. So a lot of your case examples that you presented us with were related to students that are resistant to reaching out to resources and or just don't respond. And so I think it's important to kind of take a step back and kind of think about, why is there resistance, or why is the student not responding? So one, timing. So like I mentioned previously, you are seeing students at one time point in their one time point. You're only seeing them in one context. They may have other things that they're prioritizing first, and this may not be the right time for them to reach out. Another thing, like I've mentioned before, is stigma. Stigma can really affect people's ability to reach out for support. So that can definitely affect why people might be resistant. And then another thing that we've mentioned a few times is the lack of awareness piece. So students may not be aware of how much it is affecting them. And so that self-exploration piece is so important, so that the student figures out what their needs are and then reaches out on their own. So even if that takes some trial and error, that self-exploration piece is really important. And then a lot of people forget that reaching out to support is difficult. So oftentimes when you're meeting with students and you're presenting your concerns, they might be sharing information with you that is really sensitive or they've never shared with anybody else. And now you're asking them to go share it with possibly strangers, and then they just have to rip open the Band-Aid and tell them pretty much everything that's going on. And so that piece can be really difficult, and kind of empathizing with that when you do refer students and they may be resistant. It is really difficult. And then it's important to recognize what your responsibilities are versus the students. So you are providing the students with resources, you're bringing their concerning behaviors to their attention, but it's their responsibility to ultimately connect and utilize those resources. If you feel like you might not be doing enough, or you're concerned that there might be something else you can do, consult with your colleagues or consult with CMU resources and bounce off ideas. But sometimes there is only so much that you can do. And then I just have a few tips on supporting students virtually. So like I mentioned previously, you want to make sure you advertise your availability to make students feel that they can come to you and talk with you. Even in the virtual setting, you want to make sure that you're providing written and verbal instruction for those students that may process information differently. And then organize group discussions. Maybe they don't have to be mandatory, but this is a very isolating time, and these group discussions may be the only connection with their peers that students may have. And so having those group discussions can be helpful. And then incorporating check-ins can be more helpful than I think people realize. So depending on how big your class is, if you can check in with everybody and see how they're doing, or in a small group or individually, just saying, hey, are you doing okay? How has the transition been for you? And then it's important to acknowledge and validate students' feelings. Many students are feeling loss, isolation, fear, and frustration that I'm sure many of you are also feeling as well. So acknowledging those feelings and validating them can be really meaningful and powerful for students. And then just some Zoom tips. So provide guidelines for Zoom etiquette and expectations. Make it very clear about what you're expecting your students to provide. So even if you're unable to incorporate some of these tips in your class based off of what the needs are of your class, make sure it's very clear that students know what they're expected to do and what they aren't. That will, one, help students better understand how they should be participating, and it also can help you to point out if students aren't meeting that etiquette or expectations. If possible, give students the option to use their camera. And another thing is to keep lectures and meetings short. I don't know about you all, but sitting in watching long webinars can be kind of difficult, as I'm droning on. But if you can somehow break up your lectures, maybe into 20-minute intervals, it might be easier for some students to swallow that information rather than watching a 1 to 2 hour lecture. Even if it means that you may have a few more videos to watch, having them 20 minutes can be easier to manage. And then also find alternative ways to participate, whether that's using the chat, polls, or breakout rooms, because talking on the camera may not be so comfortable for everybody. And then that's it for my portion.
All right, so we are going to, thank you so much, Amy. We are going to move into the breakout room portion. And what we're gonna do is give you 2 case studies, which Amy's going to put up in the chat so that everyone can see. But we're gonna assign breakout rooms for about 3 to 4 minutes. All right, welcome back, everybody. I know we did not give you a whole lot of time, but appreciate your whizzing through that. So what we're gonna do is we're gonna start with case number 1, Johnny. So we'll just kind of have each of the breakout rooms that worked on case number 1 talk a little bit about what your approach is. So we'll start with, just to be different, we'll start with breakout room number 9 and we'll work down.
So we decided, if Johnny was interrupting class so much, if we had an opportunity to wait until after class to say, Johnny, I'd like to talk with you, and so that we wouldn't be feeling like we're going to pounce on him, we would say something like, I'd like to get your ideas on something. Do you have time after class? And if he said no, then we would suggest making a one-on-one appointment with us, leaving it open to think, he's providing us with some ideas, and then we would just speak with him to say, I'm trying to teach everybody in the class. We didn't really go into all this deep depth discussion. We didn't have too much time, but we would like to find out your views as to your need to talk while the discussion is going on. And I know I'm not saying that right. I'm not a psychologist or anything. And if he gave his interpretation or his input on that, we would work with him and kind of end it there. And then the next class, if he would continue to do so, try to get his input in class, but yet in a way that wouldn't be offensive. Say, let's save questions to after this presentation. If it got to the point where we couldn't manage, then we decided we would resource him to the CAPS counseling.
Okay. Thank you so much. Gonna hopefully give everybody a chance to speak. So breakout room 7, other ideas?
I can hop in. So we actually shared very similar thoughts where talking to the student outside of class is probably, it feels like the right venue to discuss appropriate behavior in the course. We've encountered this a couple times, and a lot of times we say, like, that's very interesting, but let's continue this discussion after class. That's easier to do if it's like related but outside of the scope of the course. It seems a little bit harder to do if it's stuff that's genuinely way far outside the material for the course, but regardless, kind of pulling it outside seems like the right way to address that matter.
Okay, great. Breakout room 5.
Yeah, so we had some conversation about making sure to normalize the input and the feeling. So we at no point want to make the student feel as though that engagement or feedback or anything of that nature is not valuable, because the last thing we want to do is to discourage engagement. So trying to shift towards what the appropriate engagement does look like, but first affirming that engagement is good, but then here's how we have proper engagement instead.
Yeah, that's one of the terms that we talk about sometimes is saying, what's kind of expected behavior. Sometimes people want to use the word, appropriate or inappropriate.
Expected, yeah.
Yeah. So sometimes expected is really good, because that kind of helps people who may not pick up on those social cues, what is expected. Okay. Well, we can go ahead then to case number 2, Shreya, who is feeling kind of not so great about her job search. So we'll work our way up. We'll start with breakout room 2.
We kept it short and sweet. We would ask her if she ever interviewed before, and if she has, what went well, to kind of focus on that first. As far as her qualifications, remind her of small victories that she has had, and encourage or reassure her that she does have qualifications, and CPDC would be a resource as well as, which I didn't know about, so thank you, Brian, about peer opportunities in dorm rooms. I guess they have, you know, workshops and stuff in the dorms that they could work with a person on too.
Awesome suggestions. Thank you. Room 4.
Okay, that's going to be me, Eva. So we didn't get very far, but what we imagined is that maybe we imagined that potentially she might be very resistant. Like she might really, if she's really in a negative space, she might be very stuck in that. And so Amy had the idea of doing some role playing with her, interview role playing, and then Amy wrote a nice statement where she said something like, now you know what you think about your interviewing skills. Let's find out what other people think and maybe connect her to career services to do some mock interviewing to really get some have her opinion be based in feedback from somebody who has skills and understanding in the area.
Love it. Great ideas. Room 6.
I'm not sure if I can add much to what was said. Just great tips. What we talked about was obviously being empathic, listening to what their concerns and their anxieties about interviewing. I'd also probably add a little bit of a reality check. Maybe they only had one interview and they think they stink at interviewing because they didn't get called back. And just to give them an idea that, well, a lot of students, it takes, you know, a few times to start to hit your stride. And then the last thing we would do would be to schedule another meeting with the CPDC right there before they leave to say, let's continue this conversation because we do have resources we can help you with.
Okay, thank you. A couple more. Breakout room 8, breakout room 10. You guys have anything to add?
Yeah, I've got something, Catherine.
Thanks.
We talked a lot about taking a step back and normalizing what's going on for the student right now. You know, she's going through a big transition of, you know, being in school for so long, and now transitioning into a job can be, you know, very stressful for anyone. And so making sure, you know, she feels very comfortable to talk about, you know, the overall stressors that come with interviewing and that everyone faces it and that, you know, she's not alone. You know, I'd probably talk about some of my own experiences in making that transition if I had a good relationship with a student. And then also thinking about, you know, potentially connecting the student with a faculty member that she was close with that's, you know, was specific in her field of practice, who could talk about the job markets, you know, especially if they had experience in that area, and then making sure we were to connect them back to, you know, the Olitsky program as well as the CPDC to continue practicing and making sure that, you know, they weren't as nervous about doing interviews.
Awesome. Great suggestions. Okay. Well, for the sake of time, we got a ton of fabulous questions. Thank you all so much for submitting these. So I'm going to get through as many as I can and still get you guys out right on time at 1. So Jasmine asked, how do you objectively tell someone that they stink? Which I love that question. And that's obviously not the phrase you would say, but I think we want to go back to this kind of phrasing of what's expected and just what you're perceiving. And it really depends on your relationship with the person. You know, if this is a student in a large lecture where you've really never talked to them before and you don't have much of a relationship with them, I probably wouldn't bring that up myself, but maybe try to find out who has a closer relationship with that student and might be able to discuss it. Might be a question for a house fellow, you know, or somebody that's working more closely with them. Thank you, Brian. House fellows do it all the time. Awesome. So I think that's a great resource. But if you have a good relationship with the student and you feel comfortable kind of sharing what that expected behavior is and what your observations are, I think sometimes people think that being honest means that you're not being kind. And I think there's a way to be honest, but infuse kindness into that conversation. Next question from Kevin. Virtual Zoom appointments, kind of backgrounds, how to create a good background for that. I'm going to flip that to Amy because visuals and Zoom backgrounds and thing are not my area of expertise. Amy, do you have any suggestions on Kevin's question?
Yeah, I think just making sure that you are visible to the student. So make sure that your lighting is okay, and then checking in with the student to make sure that they can hear you clearly. The student is going to be able to kind of adapt their environment that they're in to be more comforting to them. But you can also ask the student if they're comfortable or if they can see you or if the lighting is okay. Ask them if there's any adjustments that you can do to make them more comfortable.
And the reason I was asking that was I had a student who I used to have a background that it's that stock CMU campus image you can get from the CMU Zoom site, and I think it was the Pouch Bridge. And the student I was working with, who I was on the spectrum, they focused on that. They said, "What is that?" And I said, "Well, it's just a background." And then they didn't. That's all they wanted to think about. Just talk about that and say, "What time of day was that? What angle?" And I said, I'm not sure. Anyway, let's get back to what,
Yeah.
that it really distracted that student. So I just went to a plain background like I have now.
Yeah, that's a great suggestion.
I had a similar incident actually with a student that I was talking to, where the student really focused on not just my seeing eye dog, but on his feet in particular. Like he was really looking at the dog's feet and kind of commenting on that. And I did what you did. I kind of redirected the student and said, okay, we really need to focus. So the student kind of needed that direct feedback that what they were focusing on was not what was important in the meeting right at that time. Great question. Question from Vicky about disability resources kind of description language and putting that in syllabus, and is that general enough for each student? I think that's a good question. The text that Amy had kind of given was designed to be customizable from one student to the next, to say, disability resources provide support for people who, fill in the blank. There is some general language on syllabi on Eberly's website that you can use that we really encourage about what disability resources does for putting into syllabi. But I think this is more for customizing when you're talking to individual students. Mike has a good question about, we often hear, oh, I went to CAPS, or I went to this, or I went to that, and it didn't help me. And how do we get students to reconnect with that resource, even though they weren't really finding it helpful the first time? What I often will do sometimes is ask the student if they would like me to help kind of facilitate that communication, or dive a little bit more deeply, if they're comfortable, into, what was it about it that was or wasn't helpful. And sometimes if you're able to facilitate a conversation with them and that resource, and maybe make that introduction and kind of scaffold a little bit what type of support the student might need, sometimes that can get a student off on the right track. But there are going to be students, and this goes back to that statement where Amy said, sometimes you've done all you can do. If a student is adamant that they're not going to connect with a resource, you've given them the resource and that's all you can do. Maybe you can give them some other resources. Well, if not, CAPS, there are off-campus therapists and psychologists that you can connect with, and maybe CAPS could give you a resource, or you can make those connections on your own. But at a certain point, the student is going to be empowered to either use that resource or not. It's just a super common thing that we hear from a lot of different resources. Okay, from Lori, how do we connect a student with resources without violating their confidentiality? That's a great question, and it's a conversation that you want to have with that student if you're going to be facilitating that communication. What are you comfortable with me sharing with the student, with the advisor, the house fellow, disability resources, CAPS, whatever, and kind of come up with a plan together. If you're reaching out on behalf of a student kind of without their knowledge, which you may need to do just to add some ideas, you can always share information anonymously. I have a student who, fill in the blank, but if you're making the connection with the student and the resource, I would definitely work with the student to kind of decide together what they're comfortable with you sharing. Amy's asking, if students approach us about legal, sensitive issues, how much are we able to share? Good question. Like, are we mandated reporters? You are going to need to report it if it's a sexual assault, sexual violence type of thing, or if the student is, telling you that they're going to be harming themselves or someone else. You do need to report that, but CAPS is always a great place to and I've done this, I've called them and said, anonymous student, here's what they've shared with me. What are your thoughts? Is this something that we need to take action on? And they can be very helpful for you in telling you, is this something that, we need to follow up on? And if so, do you need to give the student's name? Okay, next question. Can we give option, this is from Vicky, can we give option for video but not audio? Sure. Depends on your class. I think it just, if that works for you, to be able to share, have them share, be connected via video, but you don't necessarily need them to participate auditorily, that's fine, especially if you can do a chat thing, or you can do audio but not video. It just depends on how your class is structured. All right, let's see if we have any left here. Yep, we liking the expected language. Is CAPS the appropriate resource for case number 1? I think CAPS is worth consulting with, but is it a mental health challenge per se, or are we just talking about some kind of behavioral issues? It might be something that if you're not connecting with the student directly, might want to talk with the house fellow about, maybe somebody in student affairs, that kind of thing. I don't know that CAPS would necessarily directly get involved in that. All right, I think that's about all we have time to do for today. But I want to thank everybody so much for attending. We will be getting the PowerPoint presentation out. If you have any more follow-up questions or anything that we did not get to today, please definitely reach out to Amy or me, and we would be more than happy to always problem solve and help out. Thank you so much for a great webinar.
Thank you, everyone.